Singapore faces the issue of an aging population. By the year 2030, there will be 1 million persons aged 65 years old and above. By 2050, Singapore will have the 4th oldest population in the world. Studies conducted have shown that older persons with chronic conditions often have poor self-management skills due to insufficient knowledge about their condition. 3 out of 4 older persons in Singapore were found to be living with chronic diseases. Many suffer from hypertension, diabetes, and chronic respiratory diseases. It is difficult for older persons to attain a satisfactory quality of life at an affordable cost. Most older persons have poor knowledge of self-care practices that can prolong active living. This situation is aggravated by difficulties in interacting with the healthcare system. Access to services is often constrained by physical isolation, limited mobility, and a lack of information. At the household level, the sandwich generation that is caring simultaneously for children below 18 years old and older parents is facing tremendous financial burden. Also, the number of family members able to provide care and financial support to aging parents is getting smaller. Hence, a growing number end up alone and getting poorer.
Project Scope believes that we have a response to address this concern. Of course, we all know that with aging, chronic diseases, poor health, loss of function, the inability to take care of ourselves, and of course, the burden for caregivers and finances, that's what we all worry about, the burden of aging. And yet we all know that chronic diseases and disability are largely preventable and manageable, and we don't have to live a life with disability. And in fact, can live a healthy, long life, be functional, able to contribute and participate, and really celebrate the longevity that we've so hard earned in the 21st century. Now, a lot of it depends on the ability for people to take care of themselves. And for older people, throughout the life course, be able to live that kind of lifestyle, that kind of health-seeking behavior to prevent disease and disability. This is where Project Scope intends to make a difference. Project Scope is a project that takes a community development approach to help older people in the community learn about self-care and help them be motivated to change their behavior and health management in a sustainable way. It is also a collaboration between Tsao Foundation's International Longevity Center with the Tsao Foundation NUS Aging Research Initiative to really study and evaluate this project. And hopefully we'll be able to demonstrate the efficacy of this project that will be useful for policymakers.
Project Scope will combine training intervention with research to enable mildly disabled and healthy older persons to manage their health, control chronic diseases, and improve their quality of life. This project's training intervention empowers older persons, teaching them to gain power over their own lives and achieve enhanced health outcomes. Project Scope, together with partner senior activity centers and family service centers, will work with 400 randomly picked older persons. 200 will be in the intervention group, attending weekly healthcare training for 7 months. Project Scope's weekly training intervention will aim for lifestyle change by focusing on management of chronic diseases, nutrition and diet, the importance of exercise, and understanding health and social resources. The approach is highly interactive with discussions and activities to enhance physical care and mental health. At the end of their training, the older persons will set long-term personal healthcare action plans. They will also have weekly group support sessions and nominated health partners to aid their transition into achieving daily self-care.
The self-care project for older persons in Singapore is really aimed at enabling older people in the community to manage their chronic conditions, whether it's diabetes, hypertension, or chronic obstructive pulmonary disease. We have 4 main outcomes, and the first is really to empower older people to access the care that they need. The second is to improve their utilization of healthcare so that they don't use unnecessary services.
What's exciting about this project is it really provides a new model for providing healthcare. Rather than using a physician-centered, clinic-centered model, it's using a model in which people become much more directly involved in their own health care and their own health care decisions. So not only do we expect that the consequence of this is that people are going to have better control of their specific health outcomes, their diabetes and their hypertension and their breathing issues, but also that they're going to feel more empowered and that they're going to feel better about the entire experience, which at the end of the day, is what good health care is all about.
As Singapore moves from being an aging society to becoming an aged one, the self-care approach will be necessary for older persons to achieve active aging and lessen the financial impact on their caregiving families. This will also help manage the cost and pressure on the health service sector. Project Scope provides a model that harnesses community talents and resources. It is also highly replicable and mindful of the older person's need for independence. Tsao Foundation, through the International Longevity Centre Singapore, is committed to empowering older persons and realising a future of active and successful ageing for each and every Singaporean.